Hello and welcome to the very first episode of my channel. We'll dive into the world of beauty and its connection to medicine, health, and more. Let's start with a question. These days, we see so many aesthetic treatments like facelift, rhinoplasty, lip fillers, skincare routines, and Botox. But do they really work for me, or is it all just hype? On this channel, I'll be exploring questions like this, dive into the area of beauty and aesthetic medicine. Take a moment and look at these two sides. Which one do you think is more beautiful? Most of us judge beauty at first glance, but in aesthetic medicine, beauty is more than just what looks good. It's about balance, symmetry, skin quality, and even emotional expression. In this channel, we'll explore what beauty really means through both medical and personal perspectives. I'm a specialist in community and preventive medicine. I created this channel to bring you evidence-based insights into beauty and aesthetic medicine. Let's explore how to make informed and confident choices together. A lot of people think aesthetic medicine is something new, something that came out of social media or modern beauty trends. Look closely. You can see earrings in the ears and even the nose. Even back then, people were decorating their bodies and expressing beauty in unique ways. Take a look at this piercing. In my opinion, it's beautiful. While nose piercing can be seen as fashionable, it's important to consider potential health risks such as infections or allergies. Understanding both the aesthetic and medical aspects helps in making informed choices. Nose piercings aren't just about looking good. Sometimes they're about independence, rebellion, or being different. In many cultures, they are a big part of body art and can also be a way to show strength or power. It's really important to consider the health side of things too. Getting a piercing might seem simple, but if it's not done properly, it can lead to infections, allergic reactions, or other complications. So here is a question. Who should be doing piercings? In countries like Germany and Sweden, it's often limited to healthcare professionals to make sure the procedure is safe and hygienic. That tells us something important. Sometimes nose piercing isn't just a fashion choice. It's a medical procedure that should be handled by people who understand health. Beauty standards are shaped by a variety of perspectives, including medical, cultural, and social influences. These standards dictate what's considered attractive, often changing over time and across cultures. They have a profound impact on individuals' self-esteem, mental health, and social interactions. Understanding these different viewpoints helps us grasp how deeply beauty ideals influence our lives. Unrealistic beauty standards can cause individuals to develop negative body image, which is linked to serious mental health problems. These include depression, anxiety, and low self-esteem, which may impair daily functioning. Additionally, such standards can lead to eating disorders like anorexia and even self-harm behaviors. So, promoting healthy and realistic body images is crucial for mental well-being. Research shows a significant correlation between dissatisfaction with one's body and the risk of suicidal thoughts. Studies estimate that between 20 to 40% of adolescents experiencing body dissatisfaction report thinking about suicide. It highlights the importance of addressing these issues proactively. Many individuals seek cosmetic procedures with the hope of achieving beauty standards, but dissatisfaction remains an issue. Up to 15% of cosmetic patients may seek revision surgeries due to unmet expectations or dissatisfaction with results. This reflects the complexity of beauty perception and the difficulty in satisfying diverse personal ideals. Effective communication and realistic goals are essential in cosmetic practice. Poor satisfaction after cosmetic surgery is often linked to a lack of clear communication between patients and healthcare providers. Patients may have unrealistic expectations or misunderstand what can be achieved, leading to disappointment. Proper consultation and psychological assessment can improve outcomes and satisfaction. It's important for practitioners to help align patient expectations with achievable results. What's the next subject? Our next topic is whole body attractiveness and beauty from a medical perspective. We'll look at the scientific standards of beauty and compare them with the unrealistic ideals often promoted by the media. We'll explore this in more depth in future videos. Let's move on to the next topic, the importance of psychiatric issues in the realm of beauty. Before performing cosmetic procedures, it's sometimes necessary to conduct psychiatric evaluations. These assessments help determine if patients have underlying mental health issues such as body dysmorphic disorder or perfectionism, which may affect their satisfaction with outcomes. So, addressing mental health concerns beforehand can prevent additional psychological harm. It ensures that cosmetic interventions are appropriate and beneficial. Cosmetic procedures are not only about aesthetic enhancement, but are influenced by a broad range of fields, including history, medicine, psychiatry, sociology, art, and psychology. These disciplines help understand why people seek beauty treatments and how societal norms and cultural values impact these choices. A multidisciplinary approach fosters better patient care and realistic expectations. It emphasizes that beauty is a complex, multifaceted concept. The concept of beauty is complex and it varies across cultures and individuals. In this channel, we'll explore beauty from different angles and perspectives. We've reached the end of this session. Follow me for more interesting videos and have a great day.